For healthcare providers, there is perhaps no word that elicits as much fear, anger, and confusion as malpractice, as stated by the Board of Directors of Orlando Health in 2019. This leads to today's research question. To what extent have the four elements of medical malpractice affected the healthcare system in the United States? Which one can base an argument that the four elements of medical malpractice have negatively impacted the healthcare system in the United States through slowing down medical advancements, creating a fear of care, and affecting the reputation of healthcare providers. Good afternoon, my name is Honorella Martinez, and today I will be guiding you through medical malpractice. In order to understand this topic, you need to understand what the four elements of medical negligence are. These being duty, breach of duty, actual and proximate causation, and injury. This is the standard of care, deviation of care, analysis of care, and proof of care. First of all, slowing medical advancements. We currently live in a nation where the slowing of medical advancements hasn't made much progression in the United States. From the 19th and early 20th centuries, there hasn't been many pharmaceutical drugs entered into the market, despite the increase of numbers being put into the system every single year. As you can see this graph by the Boston University, the United States is in this purple line, increasing from 1996 all the way to 2004. With as much money being spent from physicians in the medical malpractice lawsuits, researchers can't help but put together that there has been more money put by physicians into malpractice lawsuits and less research being done every year. This leads us to today's next topic. It's not working. It's weird. Fear of care. The Congressional Budget Office has stated that American doctors often rail against the country's medical malpractice system, which they say forces them to create unnecessary procedures and tests that can cause trauma to these patients just because they are scared that a patient will sue them. But Congress isn't the first to notice this. As stated by the Peterson KFF healthcare system, from 1970 all the way to 2020, the state and federal funds have increased over $200 billion. This medical spending is going into procedures and unnecessary medical testing. Not only does this affect the doctors, insurance companies, and financial situations, but it can lead to traumatic experiences for patients who are being put through testing that isn't even necessary. The Congressional Budget Office has researchers from Duke and MIT that have found the possibility that the increase of intensity of healthcare patients that were received has increased by 5%. But these patients who did receive the extra 5% were not even better off. This leads to a physician's fear of lawsuits. A recent study conducted by, again, Boston University has at first contacted physicians treating the care of patients with nonspecific but common complaints that have Medicare. They found that the physicians feared malpractice claims that are associated with diagnostic testing. In COVID-19, images such as these that were photographed by Ward Law in 2021 show a healthcare professional that has doctors, nurses, and hospital staff overworked and working lots of hours. These long hours can create high pressure and stress situations. Images such as these were used as a wake-up call for all Americans to see around the country. These images served for those workers and the regular American to see. Likewise, in 1936, Migrant Mothers was a photograph by Lang that was used in order to wake up Americans and let them know what was going on behind the scenes of their own country throughout the Dust Bowl. This lastly leads us to the reputation of providers. In 2010, Congressman Tom Prince coined the term defensive medicine to describe how doctors feared being sued as a result of diagnostic and healthcare spending. But one cannot deny that from a patient's point of view, medical malpractice can be the worst thing that happens to them. Not only losing their quality of life and having risks of medical disabilities and even the loss of work and financial hardships, these things can happen to anyone. But the United States government cannot deny the statistics. As stated by the American Medical Association, 1 in 3 physicians have been sued by the age of 55. And out of these 55, 83% of them, coming from general surgeons and plastic surgeons, have been wrongfully sued at least once in their career. these great problems come great solutions. First, having a special government committee that can handle all court cases that handle medical malpractice lawsuits. They can also create a required nationwide course for all healthcare providers to have and know the ins and outs of medical malpractice. And lastly, they can allow these lawsuits to be public for all new patients to see. But with those solutions come some limitations. First, this could cause the government more money, and it could also cause these malpractice cases to have a delay in care and for them not to be seen as soon as possible. This could also allow providers to grow further fears as they're going into a profession being told that one person taking something far from the truth can end their whole career that they so worked for. And lastly, HIPAA protects all patients. The United States government cannot do anything about the fact that if a patient does not want its own personal information in a court case being revealed to the public, they cannot do so. Thank you. Are there any questions?
2 questions I have for you. First up, what evidence did you gather that you didn't use, and then why didn't you use it?
I gathered lots of evidence from the patient's point of view, but I decided to focus more on from the doctors and the healthcares and the lawyers because I figured mostly from the patients they were talking about their negative experience from actually being a victim of medical negligence, but I decided to focus more on the cases that weren't actual facts of medical negligence and how they affected the reputation and the life of the doctors.
All right. And if you had more time, what additional research would you conduct on this issue?
If I had more time, I would have actually focused more on the patient's point of view and put how even though there can be patients who are telling the truth about this, that the government needs to focus more on the fact that there also aren't, and people who have spent many years in these careers to obtain these licenses are being taken away from them just because one patient decided to lie for more money. And I would advise other people to have more research in that section as well.